Thank you for this chance. It's my first time for this kind of opportunity or conference. Thank you for those who have invited me. I'm from Sebeta Town Health Office, API Focal, Oromia region, Ethiopia. I'm going to present the social mobilization and advocacy for HPV vaccination here attentively. Here is an outline of the presentation. It has the background information of Sebeta Town, HPV vaccination overview, the demand creation activities we have implemented, the major challenges we have faced during implementation of these all activities, the lesson we have learned from these implementation activities, and the next steps. Here is the background information about about Sebeta, infrastructure about Sebeta. As you can see from the slide, Sebeta is one of the town located surrounding the capital Addis at 25 kilometers on southwest direction on way to the Jimma Road. The total population of Sebeta town is 172,294. That of age 14 girls are 2,102. We have 4 health centers currently serving the community. That of private health facilities are 60, starting from primary clinics, medium, including the referral, central specialty centers. That of the schools are 60. You know, these include primary, secondary, colleges, and the high schools. This is HPV vaccination overview. Ethiopia introduced HPV vaccination on December 2008. Sebeta town also started HPV vaccination based on the Ministry of Health direction using school-based strategy, outreach, and the fixed posts on health facilities or health centers. This is the major activities conducted from 2018 up to 2022 for the implementation of HPV vaccination. First, we have conducted technical. We have established technical working groups at all levels. Then we have conducted micro plan, bottom-up micro plans were conducted. Then we have implemented capacity building activities by training those school directors, vaccination team, and some others. The other is the major activities we have implemented were the advocacy meeting. This is crucial for the implementation of these all activities. You know, we have advocated all the stakeholders, including the town mayor, communication, education office, women and the children affairs, and all the stakeholders with media briefing and the engagements. We have assessed our cold chain capacities and recording, reporting, and monitoring and the evaluation activities have been conducted. This is to show you the performance from 2018 up to 2022. As you can see from the slide, all the performances, especially that of the 3 consecutive years, ranges from 95, the coverage is from 95 up to 97. That of the next for the year is 49%. As due to this is, we have implemented only HPV1. You know, we have planned to implement HPV2 in the next future. This is the major area for these all activities or for HPV vaccination. As I have tried to mention on the earlier slides, we have conducted advocacy meeting. We have conducted the advocacy meeting with these all stakeholders. You know, after we have conducted advocacy meeting, all the stakeholders took their responsibilities and implemented accordingly. For example, Sebeta Town Mayor advocated the lower level administration through official letters, and the lower level administration mobilized the community for the vaccination of age 14 HPV. Then the education office also do the same thing. You know, they advocated the the schools through official letters, and the schools mobilized the community by using the communication book of the students, by sending the consent for the parents, and the parents signed and returned back the communication book. The other is communication office. The communication office of Sebeta town, by using their Facebook page, they have mobilized the community by briefing or explaining the benefit of vaccination, HPV vaccination, on their Facebook page. The other is Women and the Children Affairs. Women and the Children Affairs mobilized the community by using the missed opportunities. When the customers visited their office, they mobilized and sent them for the HPV vaccination of age 14 girls. The religious and the community leaders are the crucial area for to address those out of school girls. You know, the religious leaders, after worship, they took some minutes to mobilize the community and send the age 14 girls for the vaccination. Even the community leaders do the same thing. They did the same thing, you know. Using different community meetings, they have mobilized the community for the vaccination. The other is cultural and the tourism office. The cultural and the tourism office mobilized the community from end to end of the town by using the town crier. This is all. This is another advocacy and the social mobilization activities. As you can see from this, His Excellency Dr. Daraje Duguma and Her Excellency Dr. Masarat Zalalem from Ministry of Health with their teams, while they have visited HPV vaccination campaign of our catchment school, of the school, our catchment, by media, with media briefing and engagement. This is another advocacy and the social mobilization activities we have implemented. As you can see, here is the Sebeta town, the Sebeta town mayor. She's the Sebeta town mayor. While she was briefing the benefit of HPV vaccination for the community, this is from Ministry of Health Facebook page. This all are the critical challenges we have faced during the implementation of these all activities. The challenges were shortage of budget for social mobilization and advocacy, for implementation, for transportation, and some others. The other is shifting from one school to another. The students, after they took HPV1, they examined the grade 8 national exam and they transferred to another school. After they have vaccinated for HPV1, they transferred to another school and they became defaulted for HPV2. The other is reaching out of school girls. It was difficult to reach out of school girls, but we have addressed them by using different mechanism. The other is hard to get students at night school. As you know, government employees work for 8 hours during the daytime. When the government employees returned back to their homes, the night shift students went to the school. At that time, it was difficult to address those night shift students. The other is parent consent. Some parents denied because of the rumors in the community. Some of the rumors said it makes our children infertile. Why only boys? They said. So it was difficult time, but we have solved it accordingly. The other was COVID-19 pandemic. You know, after we have vaccinated those children for HPV1 vaccination, the COVID-19 was declared as a pandemic by WHO. Then Ethiopian government declared state of emergency for 5 months, and the students returned back to their homes. The school closed, so we have faced challenges to address for HPV2. The lessons learned were good coordination and commitment for good performance. Presence of standby ambulance is crucial to save lives with full AFI kit, strength and good communication with the stakeholders, planning and working with stakeholders with education office by involving school directors and the teachers. Next steps. Here are the next steps. Continue collaboration with all the stakeholders, using missed opportunities for HPV vaccination, especially for those who will visit our health facilities. By using this opportunity, we will mobilize for HPV vaccination of the age 14 girls. The other is continue to vaccinate out of school girls by sustaining the outreach program. The other, facilitate to get students at night school by motivating the vaccination team. The other, community engagement and the conduct advocacy workshop. If we engage the community in our every steps, the community feel ownership and they work together as they feel ownership and they work together. The other is including HPV vaccination in health education, making HPV vaccination benefit as one of the topic at health facility during health education during morning time. The other is expansion of cervical CA screening site. Here are sample selected photos during the training of the this is the health vaccination team and health staffs. Here are the teachers and school directors. This is during mobilization of students at school for HPV vaccination during orientation. This is a community, as I have told you in the earlier slide. This is the mobilization of the community, different community meetings for mobilization of HPV vaccination. This is another selected photo for during HPV vaccination campaign. This is after she took HPV vaccination, while she was mobilizing the students for the vaccination. This is another photo for during waiting time for the vaccination. This is after they have vaccinated, they are waiting 15 to 30 minutes for AFI under observation of the health professional. Thank you.